I welcome you all to FIFA Academy once again. Now today's topic is movement of the body. So let's understand little on the movement. Movement is produced at any particular joint via muscles. Muscles contract to produce the movement. Each and every movement of your body has been given a particular name, a particular anatomical names. That specific anatomical name we are going to look now. Often we call it as anatomical terms of motion. As we saw before in directions, that we usually make the assumption that the body is in normal resting position, normal resting anatomical position, and joint movement occur from this resting position and we name it. So let's start with this. First, let's start with flexion and extension. So flexion and extension, as we saw in planes, it is in sagittal plane. Flexion refers to decreasing a joint angle and extension increasing the joint angle, as the model is doing on his elbow joint. I repeat, flexion is decreasing the joint angle, extension is increasing the joint angle back to the resting anatomical position. Like this. Next is abduction and adduction. Abduction and adduction. So abduction is moving a body part away from its resting anatomical position, and adduction is returning back to its normal resting position. Next is pronation and supination. Pronation and supination. Supination is, this happens at radioulnar joint, and supination is when your palms are facing up. Pronation is when your palms are facing down. For example, supination is how to remember. You are holding a bowl of soup. So that is your supination. Palms are facing up. You cannot hold a bowl by taking your palms down. You can hold something only when your palms are facing up. So that's supination. As we have already learned the term prone, so you can remember pronation via as if you are lying on your belly, that is prone lying. So pronation is palms facing down. Now we come to thumb. Thumb is little critical, little tough to remember, but see, flexion and extension are in the same line. It's like you drag your thumb, big thumb, you drag your thumb along with the floor outside, this is extension, and when you drag your thumb inside till your little finger, keep on dragging, that's flexion. So you're touching your thumb and going, and come back to neutral. This is flexion and extension, extension and flexion. Now when you lift your thumb in front of your first finger at 90-degree angle and come down back, this is adduction, and when you take this up, that is abduction. Again come back, this is adduction. Next is opposition. Opposition is you make a circular round and then touch your little finger, that is opposition. Coming back to neutral. Next is your pelvic tilt, anterior and posterior. So now he is going to perform anterior tilt. And now posterior tilt. Neutral. Anterior tilt. Posterior. Neutral. So this shows that anterior tilt is moving your pelvis forward, posterior is moving your pelvis backwards. Now movement of your spine. Flexion is forward bending, extension is backward bending, neutral, and then lateral flexion is side bending, neutral, and then rotation. Neutral. Next is movement of the ribs and thorax. Elevation of your shoulders, depression of your shoulders. Next is retraction and protraction. Retraction is taking your shoulders blades together behind, so taking your shoulders back. Protraction is getting your shoulders in front. Retraction is also called as adduction. Protraction is also called as abduction of your shoulder blades. Next is the movement of your mandible, your jawbone. Elevation, depression, elevation of your mandible, depression of your mandible, retraction, getting your mandible forward, protraction, taking your mandible backward, and then lateral deviation of your mandible. Now we will see external and internal rotation of the hip joints. So we will keep both the legs apart with extended knees. Now we will do internal rotation of hip joint. Rotating both the legs, thighs inwards as if touching your big toe together without bending your knee or without lifting your hips. Now external rotation is taking your big toes away. Now we will do the same movement with flexed knee, with bent knees. One knee bent, one straight. So now we will take bent knee at 90-degree angle of thigh and leg. With bent knee maintaining at 90 degrees, now he will do the internal rotation. So how will you remember this? That you have to get your leg out. So you will remember this leg out and thigh inwards. So thigh is going inward, that is internal rotation. And when thigh is coming out, leg in, that is external rotation. So I repeat once again, with straight leg, it was simple, feet apart, just rotating your thigh inwards along with your legs and taking your thighs out along with your legs, that is external rotation. But with bent knee at 90 degrees, it is thigh inwards and leg out is internal, thigh outwards and leg inside is external rotation of the hip. Now we will see tibial rotation, which happens only when you are sitting with flexed knee. Feet apart, internal rotation of tibia and external rotation of tibia. Without moving your knee joints, taking your feet closer to each other and then outward. This is a very small movement. So you will be doing this without moving your thighs or knees. Internal rotation and external rotation. Now we will see ankle movements. So we have two movements here, dorsiflexion and plantar flexion. This is dorsiflexion, taking your leg up. Down is plantar flexion. So once again I repeat, dorsiflexion is taking your toes up and plantar flexion is taking it down. Now dorsiflexion and plantar flexion. Dorsiflexion of both together and plantar flexion both together. Yes. This is inversion. Now eversion. E-V-E. In is inside